sunny Monday. Kind of cool where I am, but at least the sun's out.
Mm-hmm.
So let's see. I think we're all here the last time. Do we all know each other? Do you want, or does anybody want a quick reintroduction? Lori, do you know everyone?
Yeah, I feel like we met pretty much yeah, I think so.
Yeah, I think Chad was the only one who wasn't at the first meeting. Or the second meeting. I don't know. Depends on which one.
Thanks for calling me out. Good job. Thank you.
Welcome. But we're glad to have you back.
Yeah, I bet.
Okay. Well, then I think we can just jump right into it. Natalie, I can't remember. Did we come up with an actual agenda that we want to share? Like we can pull up and show everybody in terms of what we're going to cover today?
I think it was more informal.
Yeah. So just as a reminder, this is the business and industry sector, and we are still going through strategy prioritization. There are 5 business and industry strategies from the National Physical Activity Plan that we're using as a guide. The first meeting, we made it through 3 of those strategies. Today, we're going to make it through the last 2, and then we'll go through a little bit of an exercise in terms of strategy prioritization, meaning how we'll talk about how likely these are to be implemented and their impact. So to get us started, what I wanted to do was bring back up, let me back up for just a second. We're doing this strategy prioritization process through Jamboard. So everyone that was with us at our last meeting, we're using the same tool that we used in the first one, and it's just an interactive whiteboard. Natalie can drop that link in the chat so everyone can pull it up themselves so that you can interact with the whiteboard or with the whiteboard yourselves. We'll also be, in it and can be typing in responses as well. But Natalie can share her screen and we'll show you a little bit what it looks like. What I'd like to do to get us started before I turn it back over to Missy and Tanya is walk back through the first 3 strategies just to sort of remind ourselves and ground us in that conversation we had at our first meeting. And I wanted us to think about, is there anything else we want to add here or anything that we might have missed? So as we're reviewing these strategies, we're first of all thinking about whether or not it's being done. If so, who is implementing it or who can implement it? Whether it's being done or not, what are potential barriers to success? What are some ideas for how we might overcome the barriers, and then who might be missing from the work? So we've done this for the first 3 strategies. So what I wanted to do real quick is just go over these first ones again, talk through them, see if there's anything else that anybody else wants to add before we move on to strategies 4 and strategy 5. So I'm just going to read the strategies real quick and then give a couple of highlights and pause for anyone to give any additional feedback. So strategy 1 is businesses should adopt employees, opportunities, and incentives to adopt and maintain a physically active lifestyle. Essentially, to me, this is businesses should have employee wellness programs. And so the group decided or determined overwhelmingly, yes, this really is being done. Most businesses do have wellness policies and programs already in place. And then we talked a little bit about how those are being done. I don't want to say all of them are doing it. What we've noticed is small businesses might be missing some of these opportunities. And then in terms of who's missing from the conversation, we feel like we're missing some smaller companies, but we're also missing the benefit reps. So in terms of who implements this strategy, most often it occurs through the benefits or HR. It's done through company policies or practices. And then there might be other groups or departments across an organization that helps to implement it. You can see facilities listed there. That makes sense for those who have on-site fitness facilities or other things. You might bring in other departments across your organization. In terms of barriers and overcoming barriers, some of the things are pretty common. You hear it often. So what information are you getting? Are you tracking it? Is it making a difference? So what's the ROI? The other one that was notable to me is individual motivation and culture. Now, it's not necessarily said that way specifically in here, but if you look at some of the barriers to success, you can see acceptability of taking breaks at work. That's sort of a culture thing to me. Access to health promotion opportunities at work could be culture. They're not comfortable working out in front of others. That's sort of individual motivation, comfort level, but culture as well. Individual behavior change, motivation. So those are barriers that we often don't think about or sort of get missed a little bit because we're just trying to get the programming in place. But now, if this is already being implemented, that's why I'm calling this piece out. Because that can be a real factor in terms of getting enough data information so that businesses understand and are being able to take advantage of the return on their investment to some of these things. So I'm going to pause for just a second and see if any of you have any additional thoughts or feedback that we want to include on this related to this strategy. Do you feel like that's a pretty reasonable summary of our conversation so far?
I feel like it encompasses it well.
Okay. Well, let's move on over to number 2. And number 2 is business strategy 2. I should say businesses should engage in cross-sectoral partnerships to promote physical activity within the workplace, and such efforts should extend to local communities and geographic regions. So for this one, while the answer isn't listed specifically like this, but the answer to is this already being done would be yes, because what's included in there are examples of how it's being done, like local races, gyms, local leagues, corporate challenge. Those are ways that it's being done. What we didn't ask is it being done broadly enough? So that's something that we should be thinking about along with this strategy. In terms of
Can
one of the
Can we add a note there that says, is it being done broad enough? Just for when we come back to this.
Yep.
Perfect. Thank you.
So one of the things I want to think about, we don't have to answer this question right now because we'll come back to it as we talk about tactics and as we talk about implementation after we finalize strategies. But I want to think about, are we missing any other cross-sectoral partnerships that currently exist, or where programming extends into the local community or geographic region? We know the obvious ones. I mean, you guys are here, corporate challenge, but there may be others that I'm just not aware of that some of the rest of you might be aware of or might hear about, that I think we want to make sure we're trying to capture in here, especially as we move on, as we get through the strategy prioritization process and move on into implementation. But do any of you know of any right now, or do we want to just keep that in here as a question? So for right now, I think we can keep that in here as a question. Are there other cross-sectoral partnerships that exist that we're missing? Okay, and then there are lots of groups that can implement this. We've highlighted Parks and Rec, we've highlighted wellness teams, fitness organizations, gyms, etc. I wanted to think a little bit about what might be either preventing it, preventing cross-sectoral partnerships from happening, and then who are additional partners that businesses could potentially partner with. And again, these are more questions that I'm posing so we don't miss them, but if you have some information or thoughts on this that we can include in here right now, I think that would be great. In terms of barriers, is there one of the things I'm thinking about, so money's always an issue, like we get that, but what I'm thinking of are what are those opportunities where funding's not required? So if we're driving people to get out into parks, you're already paying for your parks and through tax dollars. Now you're not paying for every single park that exists out there, but you know, I'm thinking about what are those free opportunities you can get, just need to get outside. But what are there any challenges in terms of engaging in sectoral partnerships? What are those things that I might not be thinking about or others might not be thinking about that are a challenge, whether it's liability or I mean, I don't even know what.
And this is barriers that the corporations are facing, not barriers that individuals may be facing, correct?
Right.
Or both?
Yes, that's what I'm thinking about, because
Yeah.
this is about engaging in cross-sectoral partnerships between businesses and other groups. So it's sort of above the individual at this point. One example I think about that's not necessarily, may or may not be applicable in this sector, but schools have had this problem in the past. So joint use agreements. So they're school facilities, schools have lots of great physical activity facilities on their campuses, but they often don't let outside groups come in and use those, mostly from a liability perspective. So over the last, I'm going to say 5 to 10 years, they've been working very hard to address those issues. What do they need to put in place in terms of insurance coverage or other things to come up with joint use agreements so that those facilities don't sit dormant? That's what I'm thinking about when I'm saying, are there, what might we be missing in terms of cross-sectoral partnership opportunities and the ability to work?
I think another one would be just the capacity of their staffing to, you know, take on those additional responsibilities and necessary requirements to have those partnerships functional and productive.
Certainly could be. It could increase demand so much that regardless of whether or not they're paying, you know, you have to pay either organization, somebody's paying because staff time is increasing.
Yeah. Or you just have to have the staff to have the time to organize it and
Yeah.
and have those conversations with you know, the cross-sectorial individuals.
Yeah, that's a good example. That's a good thing to add.
Just the manpower.
Right?
Maybe another barrier would be just the education around the benefits of it. And the value in it. That might be more overcoming the barriers, but
Well, certainly there's certainly that, what do I get? What do you get? So it ties into that lack of working together, sharing. So I'm trying to get at why is there a lack of working together and sharing? And then
I
the
think
other
you
part,
nailed it with liability being a big one.
so that could be something, or maybe it should be something that we include in here as a potential barrier to success. Here,
Mhm.
liability.
So all of those suggestions, I mean, eventually just lead all back to your funding, right? So whether it's liability or whether it's have to bring more staff in because we got people coming in, or ooh, they want to use my facility or whatever. How can we make $1 or $2 off of them? I mean, so everything's going to come back to incentives or liability, and somebody spending more money to be able to help others, do what they need to do.
Yeah. But those are a couple of good things.
Yeah.
Some good new additional things to add in here to
Mhm.
make sure we're not forgetting those pieces. And then I think, and we can come back to this as well, are there other, we've mentioned who's missing, but I feel like we're putting that in there more from, well, what I want to think about is, are there other businesses or organizations that we haven't listed in here that would be good partners for employee wellness programs? Are there those that we've not already included? So we've mentioned in terms of implementing, who's implementing. So that's okay. Now we're thinking about who's not available, who's not already here. Parks and Rec's already here.
Mhm.
So we've got some good other regional chambers. We added that last time. I think that's an excellent one to include on here. So we've got the Greater Kansas City Chamber represented well. They've got a great reach, but we want to make sure we're not missing the other smaller local or regional chambers that can also help extend the reach of this work. Anything else to add to this before we move on to 3 and then go into our work with 4? Okay, and keep in mind, we can always come back to this. So let's go on to strategy 3. Review it real quick, and then we'll move on to 4 and 5. So as Natalie's pulling that up, strategy 3 is professional and scientific society should create and widely disseminate a concise, powerful, and compelling business case for investment in physical activity promotion. So as you can see, that big bold yes, we feel like that is already being done, has been done, is been done. It's been done by the CDC, WCOA, ACSM, Lancet Medical Journal. So there's lots of information that demonstrates why businesses would want to engage in the promotion of employee well-being and specifically invest in physical activity promotion. So one of the things we're going to think of from our perspective is gathering that information so that as businesses are looking for where is that, we can make it easily accessible to them. I think the question is, guidelines exist, recommendations exist. How are they implemented is a question that I have. And so that hits on the barriers to success and then potentially overcoming the barriers. And we already know that we're missing researchers in this effort at this point. Anything else to think about in terms of implementing the recommendations? So the recommendations exist. The barriers and the overcoming barriers in this section should really are really about achieving that strategy, but we think that strategy is being done. So now I'm thinking about the barriers in terms of implementation. Any thoughts we want to add to this or anything else to consider in this strategy before we move on? I will highlight that one of the things we talked about at the last meeting is related to this whole group of unqualified experts. And it exists in a variety of well-being areas, nutrition, physical activity, mental health, all kinds of things. And so while we do have professional and scientific societies who have come up with the business case, it's often being challenged by unqualified experts who are either self-proclaimed or proclaimed by others to be influencers. Well, influencers do just that, influence, but they're not necessarily doing it in an accurate or evidence-based way. So that's another thing that I think we just kind of park in the back of our minds and think about as we move through the process and get more into implementation. Anything else? Anyone else wants to add as notes or considerations before we move on? Okay. So I'm going to turn it over to Missy and Tanya to take it from here.
All right. Tanya, you want to take this one?
Yeah, I can grab this one.
Okay.
Am I off mute? Cool. So strategy 4, professional and scientific societies should develop and advocate for policies that promote physical activity in workplace settings. So do we feel like this is already being done? And we all have access just to click on the post-its and go, right? And type, maybe.
I think it's already being done, at least in some of the Kansas City corporations. It's definitely already being implemented, and they have professionals on site developing and advocating to promote those physical activities, right there in the workplace. What are others' thoughts on it?
And I think there's a variety of different size companies that are already doing it, large and smaller.
And I'm thinking a little bit broader. So for the professional and scientific societies that have developed and are advocating for this, one of them is the National Physical Activity Plan, on
Mhm.
which we build our work. So they have been doing this for over 10 years. So it's a good lesson in how long this takes to make a change in terms of seeing numbers change. And then most recently, the White House Conference on Nutrition and Health, I think that says healthy, it should say health. Actually, it doesn't even say a word. There, in one of those 5 pillars, one of them is about physical activity. And so I think that's an important thing to note. There is movement in this area.
So do we feel like maybe there's anything local to KC specifically that's being done? Are we thinking it's more all on a larger scale?
Those national organizations.
Well, so we are doing it. This is doing it. I would call this more of a professional society versus a scientific one. Of course, I think the chamber is doing it. Well, yeah, I call them a professional society.
I was going to say, I'm not sure how we're defining society, but We
That's where I
definitely
was.
promote physical activity in our certification. Mhm.
You know, the local American Heart Association has put on different gatherings, presentations on physical activity in the workplace over the years. So that's happening locally.
Did we capture that in there, Missy?
I can add it. Oh, got it.
There it is, yeah.
I think it's slow on some of ours.
And that could expand even more to national organizations that have local chapters that have been promoting that, like the American Heart Association. I think the region for ACSM, their regional one, to puts on efforts within this area. And so that little sticky note could expand to be national organizations with local chapters supporting efforts.
I'd say maybe different walks would be part of this as well. Like JDRF that helps with preventing juvenile diabetes,
Mm-hmm.
and all their research and funding that they have going into that.
And as they promote, like that's a good example of, okay, so JDRF promotes physical activity. Are they saying in their walks, are they promoting it from a health benefit standpoint? Like it improves rheumatoid arthritis?
Someone can jump in.
No, wait. JDRF is diabetes. I'm thinking JRA, juvenile rheumatoid, JRAF.
Yeah, in my experience, JDRF isn't, the walk is more of a fundraiser, and they focus on type 1 diabetes, which isn't strictly correlated to exercise in youth. But I haven't been super involved in this local chapter.
And that, you know what, that might be, well, let's see. And how are they promoting physical activity in workplace settings? I guess would be the other thing.
So for us, it was specifically getting our associates together this year, supporting several of them that are heavily involved in it because they have type 1 diabetes, and then doing the walk together. Several of them would meet prior and walk, and then they'd go together and do the walk. So a little bit more just kind of that community involvement, getting associates excited for some kind of event that they're more willing to prepare for ahead of time.
I think that might be a great example of overcoming the barriers, using those sorts of races, physical activities, you know, like could be an adventure race, it could be a bike race, could be a walk, could be a run, could be any of those physical activity things that are promoting, whether they're raising money for their disease or not, they're still promoting physical activity, and workplaces can use that as a motivator to create a team, participate in it outside of work, etc. I think that example could apply to many of these strategies.
I think with just speaking from Corporate Challenges point of view, there are quite a few, you know, professional societies that are encouraging their folks to be active by rewarding them, you know, with a day off or a half day off. And so I do think there is some of this already happening.
I don't know, but I'm wondering if SHRM does anything in this space. I feel like they're a big professional society in the area.
What is that? What is SHRM?
Like for HR folks. I can put the website in the chat. I'm not involved with them, but because we have a lot of HR and wellness folks on Healthy KC, we cross paths sometimes.
We haven't really used it from a wellness standpoint, but I know our HR team uses it for a lot of things. I'm not sure if it is heavier in the HR side,
Yeah, I think it might be. And
employee
it might not be-
relationships,
Mhm.
yeah, compensation.
They might not be the right fit. I was just thinking, I don't know.
It's definitely worth exploring to see what they're doing in the area. So I think that rolls right into who can implement with, ooh, my computer just went crazy with, benefits, wellness team. That we were just talking about. Thank you for adding that. My computer, just my screen went black. Okay. Who else has control or power to implement these solutions? Do you think organizational leaders within the individual business and industry, corporations?
Yes.
They definitely have the ability to empower and advocate for these policy changes or policy reinforcing these policies.
I feel like they actually might have more to remove the barriers.
That's
I
true.
feel like leadership is great in
Mm.
terms of helping with that, whereas their teams below are probably more likely to implement. But yeah, I think they're great to
Yeah.
help remove barriers.
That's very true. Good. Barriers to success or overcoming those barriers. Culture, that's a great one. I'd say sometimes funding comes back to that bottom
Always.
line.
I think funding is a big one.
Could also be time.
Mm. What about company priorities? Maybe they're not thinking that it's a priority for them. Yeah, competing priorities.
Yeah. I think this also comes down to, the staffing ability, like time and ability and capacity to take on and advocate for those policies and really get those implemented and ingrained into the culture within those companies and corporations.
I was thinking maybe lack of leadership support, but that could be the workplace champion.
Mm. Can add that into that same sticky note.
Mm-hmm.
And on the flip side, can you have too many workplace champions or
Mm,
conflicting opinions of what associates versus leaders versus whatever think is priority at that time?
I don't think you can have too many champions.
Who are we missing with speaking of workplace champions? Is what kind of perspective of a workplace champion that isn't in a typical business and industry role could potentially bring into this conversation?
So Missy, what you just said makes me
Mhm.
think about like the individual. So policies are put in place to nudge people in sort of certain directions
Mhm.
oftentimes. Or practices. I mean, I think that's the other thing to consider here. Does it have to be a policy or is it, again, you could have a practice that goes back
Yeah.
to culture. So our culture just drives people to do something versus, a policy that some might consider a mandate.
Mhm.
And I mean, not that we're not all individuals, but if the individuals that are participating are all part of the choir to begin with, how do you get new members of the choir? So if maybe we're missing those that aren't already physically active that could inform workplace wellness strategies related to physical activity, like what is it that prevents them from being
Yeah.
active? What are we missing?
What else? How's everyone feeling about where we're at on the strategy?
Pretty good.
Perfect. All right. Should we move along to the next? So strategy 5, physical activity and public health professionals should support the development and deployment of surveillance systems that monitor physical activity in U.S. workers and physical activity promotion efforts in the U.S. workplaces. Is this already being done? What are your thoughts?
I'm trying to think, we interact with a few different public health departments. But I can't think off the top of my head if any of them have physical activity as a priority or if they have data on this. I don't know if you all have already looked into that, or I can reach out. To see if they have, at least if they have the data on workers, or if they like if publicly available data too might be another piece.
Yeah.
What would be an example of this? I'm kind of having a hard time understanding.
So examples of surveillance systems would be like the, have you ever heard of the Behavioral Risk Factor Surveillance Survey? Or the Youth Risk Surveillance Survey? Or the National Health NHANES, NHANES, and oh my gosh, I'll butcher that. National Health and something Nutrition Examination Survey. Those are surveillance systems. So National Health and Nutrition Examination Survey, there you go, boom. They have methodology associated with asking questions. So it might be physical measurements, it might be survey questions that are sent out across the nation. So the National Health and Nutrition Examination Survey has both questions and then physical measurements that are done on a group of individuals over time. So you can survey and monitor over years. That one it's a CDC led survey that's been going on for, I don't know, I think at least 50 years, if not longer. And so I don't actually know of anything that's specific to physical activity promotion efforts in US workplaces. Oh yeah, I guess I don't know, Natalie, is that specific to workplaces or is that just physical
Not
activity?
necessarily, but it was like
Yeah.
one I could think of that tracks physical activity levels in different cities, metro
But it's a great
areas.
example of a surveillance system. So
Yeah.
I'm not sure that this is really being done specifically locally. I will say what we've done at Children's Mercy, in addition to the community health needs assessment that the hospital has to do as an IRS requirement for nonprofit hospitals, we do that every 3 years. We have also created the first report card on physical activity in children and youth, modeled after the National Physical Activity Report Card. So we took questions that they ask in the national surveys and asked them as part of our community health needs assessment. So that's a way for us, that's a type of surveillance system to monitor physical activity. It has nothing to do with workplaces.
Yeah. Yeah, the example I was thinking of is more broad physical activity as well with when Fitbit compiled their data into a surveillance of US physical activity study, and but yeah, it wouldn't have been strictly health professionals. It wouldn't have been for US workers.
So if it's not being done, could it possibly be because of, I'm not super familiar with the subject, but could it possibly be because of privacy or self-reporting, or are those some of the barriers that might be?
I would say, for me, I would say privacy would be
Mhm.
a big barrier of employees not wanting to provide that type of information to their employers. And then
I think self-reporting could be
self-reporting, yeah.
a good piece that Lacey mentioned as well.
Mm-hmm. I think who can implement would be city government,
Mhm.
kind of step outside of the company.
So one of the things I do, you can probably see my sticky note that I typed in there. And Grace, you can let me know how you think this might fit in, but the chamber in their certification, it's not, so this is why I said kind of, it's not really a surveillance system, but it certainly is monitoring physical activity promotion efforts in local workplaces, like members of the chamber. So if you fill out the certification, it asks about physical activity efforts.
Yeah, definitely. And that's data that we have from 2022, and then we're about to do it again in 2024. So I think, obviously anonymously, but we could take advantage of that information and data that we have.
Yeah. And Grace, remind me, because I think this is true, but I'm just to confirm, that's only for members of the chamber. Is that correct?
No, actually, anybody can take the certification and it's free.
Okay, I'm gonna
Yeah.
highlight that so we know that.
Mhm.
And then I believe that is it the Business Journal, Kansas City Business Journal, that also has some sort of certification related to employee
Yeah, I
wellness?
think they have
or
a healthiest employer.
Healthiest employer. Okay. Is that right? How I put that in there? Healthiest employer certification. And then the other one I was thinking about, and this might be, I might be off base here, but where it says kind of, but not true surveillance. So employee wellness programs well, they're monitoring physical activity in employees.
Mm-hmm.
So employees can opt in to connecting their devices to the system. I'm just going to use our example at Children's Mercy because I can't figure out how else to say this, but we use, I think it's called Virgin Pulse, and you can go on to your website and our employee wellness website, and we can connect our devices to the website so that as we sync, it automatically syncs and uploads information there too. So now we're freely giving that information to this organization that's tracking our
Mm-hmm.
wellness programs and participation, and that is monitoring actual physical activity in employees that choose to participate. That's only doing it by business. But let's just assume Virgin Pulse, I'm making it up, but let's just say they are the business or a well-being program that supports, let's say, 100 local businesses. Well, they are capturing local data. They're not likely going to share it, and they shouldn't without
Yeah.
permission.
Yeah.
Yeah, they probably
But
wouldn't do that.
right, but that gets at who's collecting it, like who could
Mhm.
potentially implement it. That's my intent in saying
Mm.
wellness, and making that
Wellness
comment.
partners.
Wellness programs, yeah,
Mhm.
like I'll edit that to say like
So going down that route, then Gympass would probably be vendors like Gympass would probably be another one, as they just sent out a lot of data for 2023 that they have. Once again, it's very generic, so that way it doesn't
Yeah.
give any private information. But
I mean, movement
Yeah.
trackers. Yeah. Any of the corporate movement trackers. Yeah.
so one of the things I think about with this strategy is it calls out US workers and US workplaces. Now, we are US workers and we work in US workplaces, but as we finalize these, is there any consideration or does this group think it's important to modify wording at all to be more specific? So we don't have to, but we can. We could say local, regional, the
Greater Kansas City region workers and
yes.
Greater Kansas City workplaces.
So the physical activity plan primarily focuses on 6 counties in the metro, 2 in Kansas, 4 in Missouri. So do we want to, again, we don't have to make the decision now. I'm just putting it out there as something to consider. Do we want to leave it as US? Because again, we are in the US, or do we want to narrow it down to be a bit more specific so we can focus the work or focus our comments and maybe tactics or other pieces that it more to what's going on here and who's involved.
Personally, I like the idea of zeroing it in to better capture what we're trying to achieve with our business and industry sector. But I'd love to hear others' thoughts on this as well. Does anyone else have a preference on how we word that strategy 5?
I think I could go either way. I think as US workers, it does infer, since we're in the Kansas City area, that we're talking about Kansas City, but it may be beneficial to hone in and put Kansas, have it worded Kansas City workers to really make it really clear.
Oh, thank you for that update, Natalie. It's good to see it side by side.
Shelley, do you think it's important to keep the language similar to the rest of the plan and say our 6-county metro area, or do you think greater Kansas City is?
I think Greater Kansas City is probably fine. I like the asterisk that you have in there. I don't think, I'd have to go back because we have a lot of strategies now, but I don't think any of them call out or say 6-county area in them. I think they're a little more broad.
Perfect. We can leave that, I suppose, for now, side by side, until we have time to marinate on it.
Again, we don't have to make that decision now. We have plenty of time for that.
Perfect. Okay. All right. Any of these other areas with barriers to success, overcoming barriers, or who are we missing? We don't have anyone right now in the who are we missing section. And we might not be missing anyone, but just wanted to make sure to point that out. Okay. Well, Shelley, I will go ahead and turn it back over to you.
Okay, and it looks like we are a little bit over our allotted time. Do all of you have just a few more minutes to hang in there? I'd like to just run through what our next kind of steps would be after this. to give you an idea of what we're going to be talking about in January when we meet again. So Natalie, do you mind going on? Can we keep going through? Okay, so our next steps that we wanted to talk about with each of these strategies, and it can be done really fairly quickly. We don't need to hash out a lot of it, but we want to get a little bit of an idea on your thoughts in terms of the impact and the difficulty related to implementing a particular strategy. So for example, with strategy 1, businesses should provide employees opportunities and incentives to adopt and maintain a physically active lifestyle. What we want to think about is how easy or hard is it to implement that strategy? And if it were implemented, what would the impact be? Would it be low or would it be high? So what we would have everyone do is grab one of those ones and move it to wherever you think it would belong on that prioritization matrix. So for example, earlier we discussed this is already being implemented, like lots of people are already being implemented. So one assumption might be that it would be easy to implement since a lot of people are already doing it already. And in terms of impact, if businesses had opportunities and incentives to be physically active, would that have a huge impact on the numbers related to physical activity? Does that make sense? By going through that exercise, it helps us figure out, is there low-hanging fruit that already exists? Or is there a quick and easy ability to get to implementation, if that makes sense? Or are those things that we need to make sure we continue doing because they're hard, but their impact is high, but we know we're not necessarily going to achieve it in 1 to 3 years? So we'll do that with each of the strategies, and then we'll move into reviewing tactics for each of the strategies as well. And Natalie, I don't know if we have an example of the tactics. Okay, so for each of the strategies, we're doing the same thing. We're going back to the tactics identified in the National Physical Activity Plan, and we're going to review them to decide whether or not they make sense for us locally, if we want to keep them as is, if we want to reword them, if we want to remove them. And so we'll be going through a similar exercise on the whiteboard using sticky notes, asking, are these already being done? If so, who's doing it or who's doing it well? Are we not sure? Is someone missing? What are common barriers to success, and whether or not we want to tweak or adjust the tactics anyway. So each strategy has somewhere, I can't remember, probably between 3 and 6 or 7 tactics that we'll review. We'll begin that process at our January meeting. So what we'd like to do is, in the notes, send you a link back to the National Physical Activity Plan, so that if you had some time and were able to, you can go back to that website to review the tactics, to think through some potential responses as we review all of this in January. Questions, comments, thoughts? If you have a link to the Jamboard, you can always refer back to it at any time. Otherwise, as a reminder, you do need to register for the meetings yourself, but we'll send you a link to the Eventbrite registration. And I hope you all have a happy, healthy holiday season. And
Happy
no football.
holidays. Thanks for joining us today, everyone.
Thank you. Happy holidays, everyone.
Bye, everyone.
Bye.